May is Maternal Mental Health Month, and in this One Belly Wednesday, I want to talk about some of the research that we're doing in chiropractic about understanding who is at risk for perinatal mood and anxiety disorders and things that we can do about it. So, one of the things that I have really been committed to over the last several years within the chiropractic profession is raising awareness about things that we can do to help moms through things like postpartum depression and anxiety disorders. And what I discovered through a combination of neurological studying and then also what we do as chiropractors, and then really by looking back through our records and seeing how what we did worked, is that there seems to be a couple extra screening steps that we can do. It's really natural for chiropractors to look at things like posture, and it's really natural for us to look at muscle tone. But one of the things that we've started getting into a lot more is how brain functions and also the different parts of the brain. There's a guy who does imaging of glucose uptake in the brain. His name is Dr. Amen. And his work is really instrumental in helping me understand things like where depression seems to live in the brain, or things like anxiety seems to live in the brain. And through some training that I did through the ICPA and some advanced workshops with Dr. Michael Hall that he was teaching, I started piecing some of this stuff together about parts of the brain that may be misfiring and ways that we can screen for it. So the frontal lobe here, these prefrontal cortex areas, are really responsible for two things that I care about as a chiropractor. The first is if it's working really well, then it relaxes the tendency for the muscles that we call flexors to tighten. I'll give you a good example. So this one that goes from the back of my head to my collarbone, the sternocleidomastoideus muscle, the SCM, when that tightens as a flexor, what it does is it tips my head to the side. You also have one in my neck called the trapezius muscle that if that flexes, then that's actually tightening and raising my shoulder up, or turning my arm out, or tightening my bicep, or maybe tightening the back of my leg, or turning my toe out to the side. All those are flexors. And so if I'm tighter on one side of my body, if I have a head tilt to the right side and a shoulder up higher, it might not just necessarily be a neck problem. It might be something going on in this cortex that's not allowing those muscles to relax because this isn't firing great. The second thing that the frontal lobes will do for us is it also shuts down the automatic response of fight or flight. So what I'm going to look for in the eyes are things like the pupils, even though I shine a light in them, are still staying big because they're looking for the tigers everywhere, right? Maybe our heart rate is a little higher, or the respiratory rate is a little higher. Maybe blood pressure is a little higher on one side than the other because the muscles are tighter on one side for the blood pressure cuff than the other side. Not necessarily a cardiac problem, but because of the lower tone in that part of the brain. So one of the things that we screen for in our office, in addition to asking our pregnant patients how they're feeling, is looking for those indicators of where things like anxiety, which tends to live in this right frontal lobe area, or depression that tends to live in this left parietal temporal occipital lobe area, and seeing if any of our patients might have some problems in those areas before they even give birth. I'll tell you a quick story. So I have a nurse friend of mine who came into my office during her second pregnancy. And as I was explaining this to her at her report of findings, that she was showing me some signs that may predispose her in our research to things like postpartum depression, she looked at me and she said, "Thank you for seeing that." She was so grateful during her first pregnancy after she gave birth that she was like, talk about baby blues. She was spiraled down into depression and she didn't really understand why. She came in to get adjusted and everything started switching for her. And she started suddenly, it broke the cycle of the what ifs and the kind of beating yourself up and just that down mood that she had. And she started feeling differently. And so when she told me this story, it really cemented home for me how important this work is. Because if perinatal mood disorders, if we look at this across the board, it impacts 1 out of 7 women. Makes it the most common condition of pregnancy, even more common than low back pain. So what we've done here in our office for years is we've been asking the questions. We've been using screening tools. Edinburgh Postnatal Depression Scale was one of them, but the Promise 29 is the National Institutes of Health's quality of life study that we've been using for a really long time in our office too. And what we're trying to publish right now, we have it submitted for publication, is a correlation between the two. But also what I teach out into the global chiropractic community is that there's ways that we may be able to screen for these things just doing chiropractic things. Because one of the things that's really special about chiropractic adjustments is that it has a very special influence on a tract of nerves every time we adjust somebody that feeds up the back part of the brain called the cerebellum and into those frontal lobe areas. So we can be very specific about feeding those areas depending on if we're screening for them. What I'd like you to find, if you don't have somebody close to you, if you don't know a chiropractor who already takes care of pregnant women on a large scale, um, go ahead and check out the ICPA. It's the International Chiropractic Pediatric Association. You can find them at discoverkidshealth.com. You can look for somebody who's Webster certified, but more importantly, also there's a advanced certification. The CACCP or the DACCP lets you know that that person has actually completed a 200 or 400-hour course of study specifically to understand the special needs of expecting moms during the perinatal period, so preconception into the postpartum phase, and children too, because that's also a very large part of our practice. So again, if you have questions about this, I love reading them. Drop them in the comments for me. We have been putting a really big push out for Instagram to help us kind of reach more of our parents out there. So if you haven't already followed Mama's Chiropractic or Doc Edwards, I've got a public profile now, so go ahead and give me a follow and share this with some people. Like I said, this is one of those things where people tend to suffer in silence, the same way they do with things like miscarriage. And it doesn't have to be that way. This isn't a normal thing. It's common though. And there's actually things that we can do. We don't have to be psychologists. We don't have to be counselors. We don't have to do group therapy. We don't have to do medication necessarily. Sometimes all we need to do is conservatively find where these problems are, where these miscommunications are, and feed the brain really good information. So until next time, take great care.